suppose I should start really quickly by announcing some acronyms that I might use inadvertently. So SDC stands for Statistical Disclosure Control. That's making sure that when you produce official statistics, no one's personal information gets leaked out. And DARE, who is the funders of some of the work I'm going to talk about, stands for Data and Analysis Research Environments. It's a big cross-UK Research Council's initiative looking at how do we make the research infrastructure fit for the future to make UK the best place to do really good research. So we've heard a lot today about how if you've got lots of data, you can train AI to do amazing things. And that's great. And it's really important to mention that there's a balancing act going here. We really want to answer key questions. The COVID stuff that happened and the amazing response of people making data available and sharing it to do things like should you put patients on their back or on the side, things like that. We know that we really need data to answer key questions. It's not just medical stuff, it's the where do you build schools, where do you build hospitals, where do we need roads and things like that in the future. But at the same time, there's a massive importance around getting people to trust you with their data and the duty of care that bodies have to make sure that if someone's trusted you with their data, you're not making it available to people who you said you wouldn't do. And this is not a new problem. It's brought to a highlight by AI, but of course it's been going on. There was quotes talking about this in 1790 in one of the first US censuses. Now, this is not a new problem, but it's just really brought to a head. And what's tended to happen over the last 30 or 40 years is that huge data organisations, people in the UK, for example, the Office for National Statistics, have been collecting data and they've been applying a whole load of internal processes, developing their understanding of what are risks to leakage of people's privacy. And then obviously increasingly people have said, well, can I have access to can I come into the ONS or similar institutions? Can I go into bits of the health service and do some research? And then they want to take those research outputs out, and how are we going to manage that? So it turns out the answer to that is something called the 5 Safes Protocol. There's a really nice picture I couldn't find when I was doing these slides, but it sort of, think of it as 5 bits of Swiss cheese, that each one of them might be individually leaky, but collectively they all provide you with reassurance. So this starts off with the idea of safe projects. So in order to do research on some confidential data, you need to have it approved that that research is in the public interest. So if they're a Caldecott Guardian, the health service, or equivalent people for the administered data service, wherever it is you're getting your data from. So it has to be safe projects, and it has to be done in a safe setting. It has to be done somewhere which is locked down and is cyber secure. Okay? It needs to be done by safe people. So it needs to be done by people who have been trained and are aware of the risks that their outputs might produce. And it has to be done on safe data. So data, wherever possible, has been pseudonymized. Don't let anyone tell you data's been anonymized. There's no such thing. Pseudonymized is the best we can do. We can take out names and we can take out addresses, but certainly the IC Information Commissioner's Office are very, very clear that your data, even with those stuff moved, is still your data and is private. And the final part is that before you produce anything and take it out, there has to be an element of a human gatekeeper who looks at it and says, this is a safe output. We understand about disclosure risks and about not producing things which would report on, or I don't know, average income of left-handed vegetarian professors of AI living in a small village south of Bristol, for example. So we don't do that sort of thing. And the 5 Safe Protocol was developed by a guy called Felix Ritchie when he was working at the Office for National Statistics. He's now a colleague at UWI. And this has been accepted internationally. This is like the global standard of how we should let researchers have access to data, and it's made real through things called trusted research environments. The NHS is in the process of setting a load of these up, and for whatever reason they've chosen to call them secure data environments, but the idea is very much the same. And there's a mantra that came out of things like Professor Ben Goldacre did a review for the UK government, and a lot of people are coming to this consensus which basically says no TRE, no research. So a lot of people who might previously have made data available for download and stuff are moving away from that model, like CPRD, who hold all the clinical data from doctors, clinics and things like that. They're all saying, no, we're all moving to this TRE model. So what does it look like? You can think of the TRE as being this big dashed line with a load of stuff inside it. And over on the left here, we've got the data repository where, in a very secure way, they're holding your data. When a project gets approved, and the research on that project is you've checked that they've done their training on what disclosure risks are, we create a subset of pseudonymized data and we put it into what we call an analytic environment. That's the place where it used to be a room. So when I started off with ONS, working with ONS in 2005, your room you went to and you left your laptop behind and your phone behind, and you weren't really even supposed to take pen and paper in, and you do your research in there on a computer, which was completely not isolated from the internet. Now we use, some of this happens virtually, but you can't copy and paste, you can't do anything like that. So you've got your analytic environment with only the data that you need to do and nothing else, and people have been entrusted to remove any excess stuff. And from that, you might typically, what people have done is you might produce some graphs, you might provide tables of results, what have you. And the last bit is this very manual checking, this human gatekeeper, where they do what's called disclosure control checking process. They look at everything they want to take out, and they make sure that it can't be unpicked to show someone's data. And then when that's approved, it gets out, and you get results out for publication. That's fine, but there is a problem there because more and more people are moving towards TREs and putting their data in TREs. More and more people are saying, we want to do really important research, the public good. So you're getting this massive bottleneck there. There aren't enough human checkers to go around. So that was something that the TREs nationally, through a whole in Dare's landscape review, said, we've got a problem here. The other problem that arose was they were kind of saying, well, we know what disclosure leakage looks like for traditional tables. We know we shouldn't report a table with less than 5 people's data in any cell and things like that. When it came to AI, they just didn't know. They didn't feel confident in doing it, and they were saying, if we're not confident, we're not going to let trained AI models out. So you can train an AI model, which might be brilliant, but you're not going to let it out. So what did they do? In order to allow that, there's 2 big projects that ran. One which is called Grey Matter, which is a horrible acronym I devised, and one called SACRO, which looked at different aspects of that. How they're helping preserve your privacy. So Grey Matter was about providing a green paper saying, what do your changes in processes need to look like in order to let models out of there? And it produced some toolkits, it produces an awful lot of recommendation thinking, an awful lot of work spoken to the public, taking on board legal aspects, ethical aspects, technical aspects to say, what are the capabilities in terms of understanding and training to let models out? Because otherwise, you can make the world's most fantastic predictive model, but if you can't take it out of your hospital's TRE, it's of no use to anyone. And then the SACRO project was partly about addressing that bottleneck, so using a different kind of AI, using rules-based AI to automate some of those processes of disclosure checking, and it had to be rules-based because that's verifiable, and we produced a consensus statement. This is ongoing. There's an awful lot of work still happening in collaboration with TREs, with data owners, with public. I'm going to be talking to people from the Isambard stuff because there's a really interesting thing there about how you get data in and out of Isambard. But I forgot to put a QR code on there because I don't really understand how to do that. I'm not that much of a techie. But public involvement is vital to all this. If you Google Dare UK and put the phrase PIE afterwards, which stands for Public Involvement Engagement, or Health Data Research UK, who are focused on how your health data is used, Admin Data Research UK, which is about how your other data is used, or just email me, All these initiatives are vitally trying to make sure that we are informed by public opinion and that we're doing what people are comfortable with your data. Okay, I'm getting messages saying, stop.